Dr. Chow, Yan Chow, Global Healthcare Strategist for Automation Anywhere. And I just had a fantastic chat session at HIMSS22 with my friend Steve Hadley from Intermountain. So Steve, want to introduce yourself?
Hi everyone, I was happy to be here with Dr. Chow. My name's Steve Hadley and I'm the Intelligent Automation Program Lead for Intermountain Healthcare.
So we had a really good discussion about the process of automation at Intermountain, and a lot of that process involves the human side of healthcare. Maybe you could explain a little bit about that and what the impact was and what the relevance was of the sort of the patient care, human side of healthcare.
Absolutely. For us, when we're building robotic process automation or any automations, we have a purpose behind it. And that purpose really does drive to the human factor. It's about how am I going to help a patient have a better experience because of the bot I'm building? How am I going to help a nurse to be able to go home earlier at night and not have to do additional work after their shift? How can I relieve that burden? How can I relieve burnout? And that really drives why we do what we do. And by connecting it to that purpose, it gives it more meaning. It makes it better for us.
So Steve, many times when we talk about automation and justifying the use of automation, we talk in terms of dollars and hours and those kind of terms that are meaningful to the CFO or CEO. But with Intermountain, there's the maybe just as important dimension of the human side of automation, the impact, the soft benefits. And I think I would love to learn more about that and how that impacts the organization in terms of its mission. What does it do for your innovation efforts, your automation, your new technologies? Is there always that lens, that you use?
Absolutely. I think it's part of our culture, actually. Most people, I think, get into healthcare, whether it's healthcare IT or caregiving, because of that higher purpose. It's a calling, right? They have that mission for themselves, and they want to help people, and we extend that. And I think as people see that they are making an impact, they're making a difference in people's lives, that it encourages them to join us and help do those things. So we see people are more ready and able to adopt the types of things that we're doing, the innovations that we're working on, because it ties them to the mission directly.
Right, and the technology that you've been doing actually helps the culture and helps the people themselves.
Absolutely.
So, yeah.
Well, and sharing it across the entire organization is really neat too, because those are the people that are closest to these types of problems. They're the ones feeling the burnout. And so really we're helping to enable people to help themselves.
Yeah. Based on the success of your program and the excitement that it's generating, what's next?
For me, I think the most exciting thing that we're working on in the near future is more with computer vision, more with capturing documents, more with capturing unstructured notes, those kind of things to create value and differentiation.
And if you could automate something personally, what would you do?
Oh my goodness, probably the dishes. I'm not a big fan of doing the dishes, but that's a different type of robot, I think.
Steve, it's been a real pleasure meeting you and working with you here at HIMSS22. It's been an exciting conference and even more interesting with the progress you're describing at Intermountain. So real pleasure to meet you.
Thank you,
and hope we continue to work together.
Absolutely. Thank you for the opportunity.